Evening, everyone. Yes, we are going to start the session now. Okay. Good evening, everyone. It gives immense pleasure to introduce our guest speaker, Dr. Sudarshini Subramaniam ma'am. She is our TADCOM's General Secretary, currently working as Associate Professor in Community Medicine at Madras Medical College, Chennai. She is also working as a voluntary physician at Rural Women's Social Education Center. She is a member of Nodal Point. Apart from her MD degree, she has done a certificate course in Health and Family Welfare Management, also research fellowship in WHO CRO on strengthening general equity and intersectionality in health policy and system research. She has a huge teaching experience, not only in training the undergraduates, postgraduate medical and paramedical students, but she is also the resource person for medical education workshop for training medical teachers, resource faculty for applied psychometrics workshop for postgraduates, and resource faculty for qualitative research methods. Coming to her contributions towards research, she has been one of the key site investigator at Chennai for phase 3 vaccine trial, that is Covaxin and Covishield. At this young age, she has done 40 publications in national and international journals. Some of her recent publications include Efficacy, Safety, Lot-to-Lot Immunogenicity of an Inactivated SARS-CoV-2 Vaccine, Interim Result of Randomized Double-Blind Controlled Phase 3 published in Lancet Journal. A Phase 2/3 participant blind, observer blind, randomized control study to assess the safety and immunogenicity of COVID-19 vaccine in adults in India, published in eClinical Medicine. SARS-CoV-2 vaccine seroprevalence in Tamil Nadu, published in Medrexil, and another study on psychosocial impact of stillbirth on women and their families in Tamil Nadu, India, a qualitative study published in BMC Pregnancy and Childbirth. She is an author for a chapter in a book in the topic Inequities in Health in India, Dalit and Adivasi Population, published in Springer, and also in Health Equity Research, a political project, Health Inequities in India, published in Springer. It's a great honor to have you here, ma'am, to share your insight on today's topic on overview of family study. On behalf of our digital wing, TADCOM, we welcome you, ma'am, for our first webinar. Okay. I also welcome our President, Dr. Arun Murugan, sir, Vice President, Dr. D. Tirunavukarasu, sir, Joint Secretary, Dr. S. Kribakaran, sir, Treasurer, Dr. Rajesh, sir, and Coordinator of our digital wing, Dr. Anantishwar, sir. I would like to extend my warm welcome to all our TADCOM members and all the participants. We welcome you all. Before our main session starts, we have a small announcement from the Compower Magazine Committee by Dr. Angelin, Joint Coordinator of the Editorial Committee, the Compower Magazine.
Good evening, everyone. Am I audible?
Yes, ma'am, you are audible, ma'am.
Sir, can I have my slides, please? Projector.
Yeah, okay, ma'am. 1 minute.
Good evening, everyone. I'm Dr. Angelin, Joint Coordinator of Compower Magazine. And I thank Digital Wing as well as all our office bearers for giving the Compower Magazine team this few minutes to introduce our magazine to all our participants of this webinar. And our magazine, the Compower, is an e-magazine by TADCOM, Tamil Nadu Alliance for Development of Community Medicine. Next. TADCOM, coming to our mission, we seek to bring together our experts and research in various fields of our community medicine so that we can foster some collaboration and share our skills, ideas in a healthy environment. And our collective goal is to drive advancements in the field of community medicine in Tamil Nadu, as well as to make a change in the field where we work as a community physicians. Next, sir. The theme for our first issue is creating a healthy tropics, special focus on neglected tropical diseases. Next. Coming to the contents of our magazine, we have a letter to editor, book review, article on the theme of neglected tropical diseases, scientific papers, expert opinion on neglected tropical diseases, event gallery, public health posters, and announcement for upcoming events. Next. Next slide, please. In the screen, we have projected our guidelines for various content of our magazine with book review and article ranging from 500 to 750 words and maximum of 1 or 2 pictures. And for event gallery and announcements, the word limit is 100 to 200 words, and with all your brochures and photographs being in JPEG format. And we have public health poster in the theme neglected tropical diseases, which should be sent to us in the image format of JPEG. Next, please. And we also have 2 competitions going on for this issue. First is the slogan competition, the topic, creating a healthy tropics, with a maximum word limit of 30, and language for writing is Tamil or English. And next competition is essay competition. The title is Neglected Tropical Diseases. The maximum word limit will be 750, and the language will be English. And we will be publishing the winners both in faculty and postgraduate criteria in our edition, in our first edition. Their contributions, the slogan and both essay will be published. Next. And for submission, the last date will be July 20th of this month. And coming to articles, all the articles will be under a thorough scrutiny by our editorial committee, and only after the scrutiny we will be publishing it in our magazine. And the mail ID for sending us article is compower.tadcom@gmail.com. Thank you. I hope we will be getting lots of your contributions. Now I hand over the session to Dr. Shobna.
Thank you, Dr. Angelin. We, as part of TADCOM, welcome you all to support our magazine with your contributions, with your articles. Now I call on Dr. Sudarshini Subramaniam ma'am to take over the session.
Thank you. May I request the organizers to please share the screen? Can I get the screen shared? Am I audible?
Yes, ma'am, you're audible, ma'am. Just a minute, ma'am. We'll share the PPT.
So, at the outset, I would like to thank the organizers of TADCOM for giving an opportunity to share my views on family study. I hope the session is useful for everyone. And yeah, let's move on to the next slide. So before even we move on to the session proper, I would request 1 or 2 volunteers or everyone to think upon certain questions that I would be raising, and I would request 1 or 2 volunteers to share their ideas after their thought. Yeah, next slide. May I request everyone to think upon these things. Have you ever thought about living in an urban slum, a perfect urban slum? You know what are the conditions of an urban slum? Have you thought about you living in an urban slum, making a living in an urban slum? Have you thought about living in a very remote village with limited access to transport? Have you thought about being part of a very poor family? Can I give you a minute, and I would like people to respond on what are their thoughts. I mean, I'm not asking to think about people who are living in an urban slum or think about people who are living in a very remote village. I'm asking you guys to put yourself living there, and I would ask certain questions for you to respond. We thought of opposite only. Okay. Can you put yourself now living in these different situations and respond to me how you would feel living there?
Use kirpapana, ways back. So then this Silamamri go and they cut me part of it. And this Silamamri guy, the one to see a cut take out the water.
Didn't hope for, but did visualize. Vulnerable. Dr. Vinodini, Sriram has given a different response. Thought of living in a slum at least for a day after watching Kakamute movie. Yeah. So what impact did it make, this Kakamute movie? Living in a slum, looking at the health aspects, how do you feel vulnerable? There are certain answers saying that you would feel vulnerable, would feel left out from rest of the citizens, dirty, unclean ambience, will do anything to come out of it, insecure. Yeah. Okay. Any other responses? Demotivated, unhygienic. Do you think that people are living in these situations because they want to? Stigmatized, unaddressed. Yeah. I would feel that there are many insurmountable challenges: adjusted, poverty, hungry, depressed. I won't have money to focus on my health if it's an urban slum. Yeah. So you have a very limited resources, and within this limited resources, you have to make yourself, push yourself to make expenditure for health. So the reason why I wanted to think about these things is actually a family study is helping us to put ourselves in their situation. By putting ourselves in their situation, in the people, among the people, putting ourselves in the situation of the people whom we are trying to address the health needs, we tend to be more empathizing with their situation, and the way we deal with the health problems would be different from the way if you had seen them just as a clinical perspective. Yeah, thank you very much for all the responses that you had been pouring in. So family study is actually trying us to put in these different situations. It is helping us to know what the situations in which the people are coming to us with various different health problems, right? Yeah, next slide, please. So I would just like to begin with a story of a 17-year-old boy, adolescent boy, Rahman. So this person, Rahman, had come to a clinic, the clinic which myself and a few friends of me volunteer. So this person had come to this clinic with history of, can you press the next button? Yeah. So he came to a rural clinic with a known history of rheumatic heart disease. So what should be the what would you be doing if you see such patient in a primary care clinic coming to you with a known history of rheumatic heart disease, and he has come to you with a severe breathlessness? So this is the situation in which a person has come. So this person has not come, familiarity for this person to go to the clinic has come because of his father, who used to come to this clinic on a regular basis for his non-communicable disease treatment. So this person has come to you with a known history of rheumatic heart disease, now suffering from acute breathlessness. And this breathlessness is not, enabling him to go to school, perform his regular duties, etc. What would be our usual action? Complete history, including family history. Okay. And then what you do if you are sitting in a primary care clinic and you encounter this patient? A regular approach would be to refer this patient to a GH, write a good referral letter and refer this patient to a GH, and that's all right. So, but knowing about his family conditions, would it help in management of this patient? Knowing about the family situation in which the patient comes, knowing about the social background, would it change the management? Do you think there would be something else that we would be doing? The second question is, knowing about the family background, knowing about the social background from which the patient is coming, would it help? Would it make changes in the management? I have given the answer as yes. Can you please help me in understanding how? Yeah, financial assessment and guidance, insurance schemes. Yes. Okay. So we will try to understand whether this patient is covered under insurance, and if the patient is not covered under insurance, we will try to link him with the system and help him get the insurance card. Yes. And then anything else that would help us? We can do surgery under CMCHS. Yes, that is what was mentioned by Dr. Vinodini Balamurugan. Anything else? Knowing about the family, knowing about the social conditions. So let me give a background of this particular patient. So 17-year-old Rahman, he's coming from a family, from a poor Muslim family. His father is an elderly father who is already a known diabetic and hypertensive, currently not occupied. The total family is dependent on the income of Rahman's brother, who's again a teenage person, in his 19, and mother is in her 40s, and so the elderly father is already having some kind of disability, and Rahman is studying in 12th standard. His concern is more about giving 12th standard exams, and their family concern is about they are living in a remote village close to Kanjipuram. So they had to come to Chennai Rajiv Gandhi Government General Hospital. So they had to depend on transport. They had to spend for the transport, coming here, living in, staying in RGGH for months together. These things were putting the entire family under pressure. So as a family physician or as a community physician, understanding these social nuances, understanding the family structure, understanding from where the person is coming, help me in doing just beyond referring this particular patient to Rajiv Gandhi General Hospital. If I had just done referral, there are higher possibilities that this person would not have gone to GH. This person would not have had his treatment, and there is a higher possibility he would have gone in for severe complications, etc. Can I have the next? So understanding the family enabled us to give a working solution to the family. So what we did was we sat together, we understood what are the concerns of the family members, what are the concerns of the patient per se, and how each things can be sorted out. So what we did was we just made a good plan about how to go regarding his health, how to go regarding his studies, how to go regarding the financial assistance, etc. And all the family members were involved in making decisions, and knowing the family, helped us in building the trust among the family members, and it also enabled us to perform the role of a health advisor. Though we had referred this person to a tertiary care center, and the cardiothoracic surgeon here was the primary person going to give treatment for this particular person, many doubts were there for this particular family regarding the treatment, regarding the surgery, regarding the outcome, regarding how many days they have to spend in the hospital, etc., etc. So for every other doubt, they would come back to us and ask us on what is this actually, what are they talking about this surgery, what would be the outcome of this surgery, etc. And knowing the family, knowing and understanding the social background helps us to break the complex terms to a language they can understand. It also helps us to link government and non-governmental agencies in the area to avail of the benefits. If we don't understand the family structure, if we don't understand the socio-economic conditions, there is no reason why we would even think about all this stuff. We would just stop with writing a referral letter and sending the patient to a hospital. We are not even bothered whether the patient goes there or not. But understanding the family structure, understanding the social background pushes us to go beyond the clinical aspect and helps the patient in giving a comprehensive care. So with this background, let me give an overview on what is a family study and what do we expect from doing a family study? What should be the outcome of a family study? Next slide. So usually in clinical case studies, we are trained to teach clinical skills, diagnostic reasoning, and planning treatment for individual patients. Whereas in clinico-social case study or in a family study, we are trying to go in deeper. We are trying to take a detailed examination for every aspects of the disease. So by doing a family study, next, we are trying to think beyond medical model of disease. So by doing a family study, we are saying that it is not just the agent host, which are interlinked, but we are also trying to think about the social model of the disease. So when I say social model of the disease, despite the agent present, the host available, and the environment, people get to live in the same environment, not all of them are getting the disease. There are many social factors which plays a role and pushes certain group of people to get the disease and certain other group not to get the disease. So family study helps us to move beyond medical model of disease, and it helps us to think about social model of disease. And next, it helps us to understand the role each family member play a role in a particular disease and its progress. And it also helps us to understand what the disease can do to the family members, what the disease can do to the family members in various aspects, medically, socially, economically, etc. So family study, it helps us to understand the role and influence of family members on the disease and its progression. Next. So it helps us to understand the impact of disease on other family members, socially, economically, and psychologically. Next. It helps us to plan a comprehensive intervention. So when I say comprehensive intervention, towards the end of the presentation, you will get to understand what do we mean by comprehensive intervention. It is not just treating for the disease, but also trying to understand the various other issues, the social issues, the economical issues, which are part of the problem, and how are we providing solutions, comprehensive solution, which optimally leverages the resources which are available within the family. So when you look at family study, so a family, we are trying to find out the cause of the disease per se. So what made people living within a family to get the disease? And is there any shared genetic component? Is there any shared cultural component which could be the reason for a disease? And then we are trying to find out the consequences of the disease. Next. Consequences of the disease. When I say consequence of the disease, if a person has got an infection, what happens to the other members of the family? Are they becoming more at risk of getting the infection, and how are we going to manage it? And what happens, what are the social consequences of the particular disease on the family? What are the psychological consequences of the disease on the family? Is the disease making people living in the family to pushing in for work absenteeism or school dropouts, etc. What are the consequences of this particular disease on the family? And finally, we are trying to look at the coping mechanisms adopted by the family. So the family study is trying to, by doing a family study, we are trying to understand the cause, the consequences of the disease, and the coping mechanism in a family as a whole. Next. Next. So what is expected out of a family study? So when you do a good family study, these are things that should be the outcome of a family study. We should be able to identify the various determinants of health which are affecting a particular family. What are the various determinants? So when we look at the determinants, we can refer to a Commission on Social Determinants of Health by WHO, which states the various social determinants which play a role in determining health. And a proper good family study should be able to show how the major determinants are interacting with each other, how the major determinants are relating to each other. And by doing a good family study, you would be able to understand the mechanisms by which these determinants act to decrease health. And next, it also provides us a framework for evaluating which of these determinants are most important to be addressed. And finally, you are able to map specific interventions for improvement of the health of the family. So understanding the determinants and how these determinants relate to each other, and in what mechanisms these determinants are playing a role to pull a person's health down, and of the intervention of the determinants, which is the key determinants, and finally making specific interventions to address these determinants is going to be the objective of a family study. So a proper family study should be able to do all these stuff. So family is an entry point to the community as well. So understanding a particular family, it means you are trying to understand the entire, community from which the family is coming. Yeah, next. So when you're doing a family study, I think we should be addressing the family study in these 10 domains. So I have taken these domains, I have mentioned the reference here. I've adapted from the reference mentioned here on approach to family assessment and intervention, and I've modified according to our needs. So when you're doing a family study, think of these 10 domains. So these are the 10 domains in which specific diagnosis for each of these domains should be made. And when you are proposing a management for the particular family, for each of the diagnoses made in each of these domains, we should be proposing solutions. So the domains are structure, family, socio-economic, environment, nutrition, cultural and social environment, availability and affordability of health system, the illness per se, and what are the threats. So we will be discussing about each of these headings. And when you're trying to, so you would be assessing each of these domains, and the results of these assessments should be making a diagnosis for each of these domains. And finally, with the diagnosis, you will be proposing solutions. So that is the ultimatum of doing a family study. So next slide. So when we talk about structure, so what are the information that we would be collecting with regard to structure? So when you're introducing a family, you would start with introducing about the demographic profile of the family as such. So when you're introducing the family, you would start with the block in which the particular person's residence is, and to which sub-center they are attached to which PHC they are attached to, and then you would introduce the family. When you're introducing the family, so when you're introducing the family, you would be starting with introducing the head of the family. So you know who's the head of the family. So the head of the family would be the it is not not always the oldest male of the family who is the key decision maker. Sometimes whoever is mentioned in the ration card or whose name has been proposed as the head of the family in census would be considered as the head of the family. not always the head of the family would be the person who's responding to you. So you would be mentioning about the name of the informant and the reliability of the informant. And then you would be mentioning about the residence, where they are actually located. When I say residence, you should be mentioning about the complete address, or detailed complete address. And we should also be mentioning about the duration of their stay in that particular address. If they had migrated recently, then we should ask from where they had migrated and the reason for migration. And you should be mentioning about the family structure. When I say family structure, you should be mentioning about how many infants are there, how many under 5 children are there, how many adolescents are there, how many adult, especially women in reproductive age group. And then you should be mentioning about the elderly geriatric population in that family. So what is the number of people in each of these age group? And you should also be mentioning about the dependency ratio. So what is the idea of collecting this information? So by doing this information, we are trying to make certain diagnosis. We can say what is the I mean, is it a big family or a small family? Is there any adverse gender ratio? You can identify any vulnerable age group, and you can identify regarding the high dependency ratio. You can identify whether there is a migration, etc. So with the structure, you should be able to make certain inferences. It could be like you could identify no problem at all, fine, but mention if there is any problem. So that would be the diagnosis based on structure. So when coming to family, the information that are required are, you should be constructing a family table. So when we are constructing a family table, I'm sorry, you're moving fast. So when you're constructing a family table, we should be mentioning about the name, all the members of the family, the age, the gender, the relationship to the head of the family, and their education, their occupation. And you should also be mentioning about the medical social conditions. So when we say about the medical social conditions, you have to mention if there is any physiological conditions like pregnancy, infancy, lactating mother, or a geriatric population. About the medical conditions, if there is any ailment, it could be tuberculosis, diabetes, hypertension, or any other ailment for which a person from which a person is suffering from. These are the medical conditions. And finally, the social conditions also should be mentioned. The social conditions commonly seen are disability, and I mean, anybody who's separated, unemployed. These are the social conditions. So when you are constructing a table, the last column of the table should be on the medico-social conditions. And you should also be mentioning about the type of family. If ask questions regarding consanguinity, I hope all of you are aware about the 4 degrees of consanguinity. And we should also mention about any vital events in the family. And if there is any vital event, more details. Yeah. If there is any vital events, we should ask more questions related to it. So vital, what are the vital, which are the events are considered as vital events? Any birth which happened in the last 1 year, any death which happened in the last 1 year, abortions, marriage, or separations, all these are considered as vital events. So if there is any vital event, ask more questions related to that. And we should also ask about immunization status of the family. So when we are talking about immunization status of the family, if there are under 5 children, we should ask about their immunization status. And now after COVID, all of us are expected to have COVID vaccines. And if there are any other vaccines that each member had, that can also be recorded when it comes to the information related to family. By asking these questions, what are we trying to identify? What are the diagnoses which we are trying to identify? We are trying to identify if there are any vulnerable group in the family. So based on the medico-social problems, we are trying to identify any vulnerable group in the family. Why we are trying to identify vulnerable group in the family? Because we want to prioritize the needs and direct resources towards the needs. So that is the reason. And understanding the family type will also help us to understand the kind of support system that is present within the family, which would help us when we are planning for the interventions. And the next is about the socio-economic conditions. Next slide, please. So Am I audible now?
Yes, ma'am. Now you're.
Fine. So regarding the socio-economic details, these are the information that we need to get. So religion, caste, the literacy status. So when we're asking about the literacy status, we have to calculate we have to know the literacy status of the head of the family, and it is also better to calculate what is the literacy rate of the entire family as such, and what occupational status of the family. So when we are saying about occupational status of the family, we have to find out if there are anybody who are adult members who are wanting to take jobs but not getting getting a job, being unemployed, not get or doing jobs which they don't actually fit in. So all these things has to be mentioned in the occupational status of the family. And then regarding the economic status, so economic status we can measure using different scales. So how to choose a scale? It depends on whether you are looking at a family in a rural area or in an urban area. So how do you define urban area? How do you define rural area? It is always better that we refer to Census 2011 definition of what is a rural area and what is a urban area. So according to Census 2011 definition, any municipality, corporation, cantonment board, notified town area, all these are considered as urban area. And again, you have to identify, if it is an urban area, you have to identify whether the particular person is coming from a slum or non-slum. Again, for the definitions of slum and non-slum, it is better to refer to Census 2011 definition of what is a slum and what is a non-slum. So depending on whether this person is coming from urban area or rural area, choice of economic scales are made. So usually if a person is coming from a urban area, modified Kupaswamy classification is used. Rural area, people who are coming from semi-urban, modified BG Prasad scales can be used. And there are other indices like standard of living index. And otherwise, we can also mention whether the person is having BPL or APL card. I mean, if you look at the ration card, we can make an inference on whether they are BPL or APL. So all these things can be mentioned when you are mentioning about the socio-economic details. And it is also better to understand about the various possession a person has, about whether they possess land or whether they possess house. I mean, are they living in a rented house or own house? Even if they are not living in a own house, they might have they might be owning a house. So it is better to ask if they have any, if they own a house, if they own any vehicle, etc. All these things are trying to help us understand the economic status of a particular family. And when you talk about economic status, it is also better to mention about the expenditure incurred towards food and health. What percentage of the total income is spent towards health and what percentage is spent towards food? Even if you're not making information about other things, at least find out what percentage is spent towards health and food. And it is always better to know if the family is having any debt, and how much percentage of the regular income is spent towards debt. And when you're mentioning about the socioeconomic details, it is also better to mention about the financial benefit schemes. The family getting any kind of financial benefit? It can be old age pension scheme, widow scheme, or disability pension, or anything. So any financial benefit schemes, the family, any member of the family is getting benefited, that has to be mentioned here. And then about health insurance, whether they have any insurance covered, and that, I mean, it could be private or a government scheme. If they are working in a sector which is covered under ESA, if they are the ESI card holder, so try to poke questions regarding any health insurance they are covered under and what is the scheme under which they are covered, that has to be mentioned. And finally, we have to mention a word about utilization of other social services. So when I say other social services, we have to find out if there are any beneficiaries of Anganwadi. We have to find out whether they are utilizing Anganwadi center, and if they are utilizing Anganwadi center, for what purpose they are utilizing the Anganwadi center, that has to be mentioned. Are they utilizing PDS, public distribution system, and if they are using PDS, for what purpose? What are they buying from PDS, and are they utilizing government hospitals and any other social services which are available there? Are they utilizing to any of these services? That has to be made mention here. So by collecting these information, what are we trying to do? So we are trying to understand, next slide. Next. So we are trying to make an inference about the literacy status, whether they are coming from poor background, whether they are coming from a caste which are usually a marginalized community, and we are also trying to find out whether they are covered under any social security schemes or any health insurance schemes. And we are also trying to make an inference on what proportion, are they pushed in for any catastrophic expenditure because of health? So these are the inferences that we are trying to cover here. I would also like to put a disclaimer. These inferences are not exhaustive. These are just indicative. You can make many inferences. But the point that I'm trying to make is, by doing for each of these domains, please find out what is the problem that you are identifying. So these problems has to be finally put together when you are going to give a comprehensive diagnosis. So next thing. So then coming to the environment. So the information that we would collect is regarding the macro environment and micro environment. So when I talk about macro environment, it is the locality, basically about the locality in which the particular family is living. So we have to understand whether it is urban or rural. If it is urban, there is a question regarding what are the other social services. So usually we would be talking about ICDS services, public distribution, and even they can, the other services, like if they are getting access for government facilities for health, that is also a kind of social service facility that people are utilizing. Sometimes they might be availing services from an NGO for different purposes. Like if there is a disabled person, they would be getting a wheelchair service from an NGO. So something like that. So depending on the family, you can find out what are the different services. Yeah, also pension scheme, old age pension scheme. CGHS is part of insurance. So if they may be like, if they are coming from a marginalized community, they're also eligible for certain quota. So those are also kind of utilization of social services scheme. Currently in Tamil Nadu, we have this free transport for women. Are they utilizing such services? So if a person is having HIV/AIDS, they are eligible for free transport. They are eligible for getting free drugs at different places. So something like that. Whatever services that are available for them, are they even utilizing it? Yeah. So coming to environment, so you should be first mentioning about the macro environment. So to talk about the macro environment, it would be better if you're making a map. You present it as a map. You can start with probably important public space. From there, you can draw a route map to this particular family's residence. So when you are talking about mentioning about this map, this helps us to understand the accessibility to and fro from the house, and it also helps us to understand how this particular community is placed, especially in certain areas. If they are living in a villages, there is a concept called as colony, where no services would be available inside the colony. They have to come outside and to avail any of the important services, just to get us an understanding about how they are connected to the important services. So that is why we are trying to find out about connectivity. better to draw a map of the area as you enter the area and locate the house in the community. And even before you move inside the house, try to mention about the external environment. Is it accident? I mean, are there any accident prone area? Are there any open drains which are present? Any vector breeding sites which are present? How the waste is being disposed? How hygienic is the particular place? Are there stray animals present? Or any other significant observations that you would want to make, you can make. So this has to be regarding the macro environment. And then regarding the, I mean, you can also mention about how the solid waste is disposed, and how the liquid waste is disposed, and any public water, I mean, any public space for getting water, public, I mean, any community toilets which are present within the streets. So all these things can be mentioned when you're mentioning about the external environment. And then while moving into the house, you would be mentioning about the, I mean, these specific things. So the general construction of the house, I mean, you would be mentioning whether they are living in a pakka house or a kacha house. And again, the definitions for pakka and kacha, please refer to Census 2011 definition on what is a pakka house and what is a kacha house. And you should be mentioning about, when you are mentioning about the house structure, you should be mentioning about the number of rooms that are available, whether they have a separate kitchen or not. And you would be mentioning about the ventilation, the lighting, and is there any overcrowding. So I assume that all of us are aware about what are the definitions for overcrowding, how to define whether the person, whether this particular house is adequately ventilated or not. It depends on the floor space to window space ratio, and window and door space to floor space ratio. So you have to then ultimately you have to measure these window size, door size, etc., and you have to make a comment on whether it is adequately ventilated, if there is any adequate lighting, etc., has to be mentioned. And then when you're mentioning about kitchen, we have to mention about I mean, again, with regards to house, you should be mentioning about the size of the house, number of rooms in the house, and you have to mention about, actually you would be drawing a house, I mean, map. You have to draw a house map with all the dimensions mentioned, and that would be enough for mentioning about the house structure as such. And then regarding kitchen, again, you have to mention whether it is you have a separate kitchen, or it is there, I mean, just as part of the house without no separations, and whether there is any specific cooking platform available or not, and what is the fuel used for cooking, is there any smoke vent available, and how is there separate wash area available for utensils, and how they store cooked food, raw food items, etc., that has to be mentioned with regards to kitchen. And regarding water supply, we have to mention about the source of water supply. Is it interrupted supply or continuous supply? Do they have piped water or unpiped water? Is it from bore well or open well or any other source? And if they're not having water supply within their house, we have to mention about the distance they have to travel to get water. So that has to be mentioned when it comes to source of water. And then how do they collect the water, how do they store the water, how frequently they collect the water, and if they have any purification methods they adopt for disinfecting the water, that has to be mentioned. And how do they use the water? Is it like I mean, having a ladle and pouring, getting water from the ladle, or is it a drum which has a tap? So how are they using the water? That has to be mentioned. So basically, by doing this water, I mean, by understanding these source of water and all these purification methods, we are trying to make an inference on are they getting safe water or not? Yeah, there are questions. What sources and book we should read for family study? So I think I would ask later. Whether the area map and macro environment are one and same? Yes. So area map and macro environment, I mean, both can be used synonymously. Yes. So if cross ventilation not present, will it be considered as inadequate ventilation? Yes. If cross ventilation is not present, it will be considered as inadequate ventilation. So regarding the waste disposal, you have to mention specifically for solid waste disposal and liquid waste disposal. So regarding solid waste disposal, you have to ask about whether they have the culture of separating biodegradable and non-biodegradable waste, and how about the waste container? Is it with a lid or without lid? What do they do after the waste is collected from the house? How do they dispose the waste generated in the house? I mean, is there what is the waste collection mechanisms that are used? Usually we don't, about daylight factor, usually we don't measure the daylight factor. The usual definition that we give is if the person is able to read in any corners of the house, we consider it as adequate lighting. I'm not sure if you are allowed to use any applications which measures the daylight factor during your exams. So regarding waste disposal, solid waste disposal, these are things that we have to consider. And also when you're talking about solid waste, liquid waste has to be equally mentioned. And then the other thing is about the sanitation, whether they have a separate bathing area, whether they have separate toilet, and if there is a toilet, what is the type of toilet that the family is using, whether the toilet is present within the house or outside the house. If the family is using a public toilet, how frequently are they using? Are the children using the public toilets? These are the questions that we should ask when you are talking about the sanitation facilities, especially the bathing and toilet facility. And if they are using any public toilets, you should also make a mention about whether these toilets are well maintained, whether adequate lighting is available in the toilets. Even if they are not using public toilets, you have to mention about the lighting and continuous water supply presence within the toilets in the home. And regarding the biological environment, when we mention about biological environment, it is basically the vector breeding sites which are present within the household, and when I say vector, it could be mosquito breeding site or fly breeding sites. So all these things has to be mentioned when you are talking about environment. So basically divided it as macro environment and micro environment. So the inference that we are trying to make by looking at the environment is whether they have access to, if the toilet is inside the home, we are saying that, inside the home or outside the home is not a matter. Whether they are having access to toilet is the matter that is the inference that we have to make. If they don't have toilet, for that particular family as such, if there is a shared toilet, then we should make inference about the frequency of its usage, whether they're actually using it or not. Because of having a shared toilets, what are the problems that they have? So this is the inference that we have to make regarding whether they have using a shared toilet or not. Next. So basically the inference that we are trying to make by doing this environmental study is we are trying to make inference regarding accident proneness, whether they are prone for particular infection. So the inference regarding toilet is if they had to use shared toilets, there is a higher possibility of it being not properly maintained and increases the risk of getting UTI, and presence of vector breeding sites pushes them to at increased risk of vector-borne diseases, and their access to wash facilities. Importance of exhaust ventilation in kitchen. Yeah, if they don't have, if the kitchen is not properly ventilated, presence of exhaust ventilation is required. If it is not there, and if the kitchen does not have a proper ventilation, there is a possibility of indoor air pollution, as somebody mentioned here, and there is also possibility of the inferences, indoor air pollution is the major inferences, and again your major inference would be inadequate ventilation, and for that you have to make a intervention for that. Next. The next domain that would be considering is nutrition. So here again, it is not just one person's nutrition we are considering, but about the entire family's nutrition status. So when we ask questions related to nutrition, we would be asking questions related to food practices, whether they are consuming vegetarian diet, or they consume a mixed diet. And what is the staple food? Usually in Tamil Nadu, rice would be the staple food. If we are if you're meeting a migrant population who is coming from other parts of the country, it could be different as well. But mention what is the staple diet and what is the meal pattern. When I say about meal pattern, you should be mentioning about, are they consuming 3 times a day, or how many, meals they consume in a day, how many snacks they consume in a day, in a usual typical day, what is their regular meal pattern. And then do a diet survey. So there are different methods of doing a diet survey. The most commonly used method are 24-hour recall method. And you can also try doing a stock inventory method can also be tried. So, so in 24-hour recall method, it is, you are actually supposed to do a dietary cycle. That means you have to get history for 7 days, and after collecting history for 7 days, then you are supposed to make the consumption based on the food groups, and you have to make a comparison whether they are taking what they are supposed to take. So then you have to calculate the nutrient requirements classification has to be met. You have to calculate the consumption units for the family. What do you mean by consumption unit? So one consumption unit is equivalent to what an adult sedentary man would is required to take. What is the energy requirement for an adult sedentary reference man? So usually 2,400 kilocalories is the adult 2,400 kilocalories is the consumption unit for an adult sedentary man. So compared to this consumption units, you are trying to make consumption units or dietary coefficients are built for other group. Adult female, adult sedentary female, adult moderate worker female, adult vigorous worker female, adolescent girls, adolescent boys, children, etc. So you have to understand the consumption unit. So one consumption unit is equal to adult sedentary man is equal to one consumption unit. So know the family structure. So if there are one adult sedentary male, one adult sedentary female, then you have to find out the dietary coefficient for each of these group, and then you have to calculate the total dietary consumption units required for that particular family. Okay, so a sedentary female is 0.9. So next is, then what you have to do is you have to assess the adequacy of dietary intake. Can you go to the next slide, please? I'll show how to do that. Next slide. So this is how we have to construct a table for looking at adequacy of dietary intake. So for one consumption unit, the ICMR has given guidelines for what should be if you want to satisfy one consumption units, what grams of cereals should be taken. So usually it is 450 grams of cereals should be taken, pulses 40 grams, vegetables 60 grams, milk 40. So you have to understand, you have to know what is the requirement for one consumption unit for each of these food groups. You will also calculate the cereals consumed, pulses consumed, vegetables consumed, milk consumed, oil and fat consumed, sugar, jaggery consumed by a particular family for one day. On an average, what is the average amount of each of these food groups consumed? You would be able to find out from the diet survey that you are doing. And then you make a comparison between the recommended dietary allowances and say whether there is a deficit or an excess. So this is the inference that you have to make by doing a dietary survey. So, again, you can refer to ICMR guidelines to understand what is the requirement. What to achieve one consumption unit, what grams of how much grams of cereals should be consumed, how much grams of each of these food groups to be consumed has to be referred to ICMR guidelines. Consumption unit is now said to be outdated according to NIN, but still, I mean, though consumption units are now outdated, it actually translates into the calorie intake. So what is the total calorie intake? So for one consumption unit, 2100 is the recent guidelines. So you can actually, you are actually now trying to make an attempt to find out whether they are having adequate amount of these food groups. So this in turn translates into whether they are having a balanced diet or not. So that is the ultimatum of doing this exercise. Can you go to the previous slide? Yeah. So in nutrition, in the domain nutrition, apart from talking about adequacy of dietary intake, it is always better to talk about the cooking and food handling practices. So how do they deal with vegetables, whether they wash it thoroughly, or how do they store perishable items and non-perishable items, and reheating habit, how frequently they reheat and use, and how do they manage the kitchen utensils, how do they clean the kitchen utensils, etc. That can be mentioned in the cooking and food handling practices. And then about individual food taboos and preferences also can be mentioned when you are talking about nutrition. So basically the idea of nutrition is whether each household member is having adequate amount of food. So whether everyone is having adequate amount of food, whether it is nutritious. So you're mentioning about, you're making an inference about whether this family is having adequate food security. And second inference that we are making is whether this family is having adequate nutrition security. When we say nutrition security, they should have, get the energy met out by all different nutrients. It should not be just predominantly by one group. And then you are also trying to find out, by doing a nutrition survey, we are trying to find out what could be the causes for underweight or overweight, and what is the deficiencies in terms of calorie, and looking at the food hygiene practices. You would also be able to make an inference on potential for food-borne diseases. Consumption unit refers only to energy requirement. Can inference be made as to other food groups, pulses, vegetables based on CMR? Yeah, ICMR has given for meeting one consumption unit, how it should come from cereals, what grams should be eaten, and what grams of pulses should be eaten. So all these different food groups, what grams should be eaten has mentioned, so that it makes it to 2100 kilocalories. So next slide. Next slide. So then the next domain is about the cultural and social environment. So we have to understand about the usual cultural practices that are followed in that particular family. So we cannot be asking about every other cultural practices, right? So depending on the vulnerable group that are present there, if you are seeing an antenatal mother, ask cultural practices relevant to antenatal mothers. If you're seeing a postnatal mother, if you're seeing a newborn, ask certain cultural practices which are pertaining to that particular vulnerable group. So that would help. So ask questions regarding the customs and health practices relevant to those vulnerable group which are present in that particular family. If you see an under 5 child, you should be asking questions regarding if you're seeing an infant, if you're seeing a newborn, you should be asking questions regarding the prelactal feeds. You should be asking questions regarding what do they think about breastfeeding, what do they think about taking artificial feeds, etc. What is the customs and health practices that has to be mentioned depending on the food group. Depending on the vulnerable group or the family structure, these questions should be mentioned. Also, you should be mentioning about the psychosocial environment and its impact on the family. I mean, if a particular person is chronically ill and bedridden, what impact, psychological impact it is creating on the family? That has to be asked. So for ANC, what can be asked? So for ANC, the usual, what would be the customs that are usually followed? How, there would be customs on having this, change of place from husband's house to mother's house, and that has an impact, right? We have to shift the mother from this particular PHC unit to the other PHC unit. So anything which are relevant, so that has to be asked. And then you have to ask about the treatment preferences. Again, depending on the particular, so for geriatric, say for example, if they have osteoarthritis, what is the treatment preference they have? Whether they prefer to go to allopathy or yoga, or what are the treatment preferences? Whether they prefer to have local remedies. So what is the treatment preferences they have? So these kind of questions, again, pertaining to that particular vulnerable group, we have to ask. So next. So basically, we're trying to understand about the knowledge, attitude, and key behaviors. So in antenatal care, as Dr. Gayatri has asked, in antenatal care, there are certain food taboos. They are not allowed to eat certain kind of food. They are not allowed to do certain activities. They are not allowed to, go out in the evening hours, etc. There would be certain customs, in different groups. So similar questions can be asked. So basically, the understanding is you are aware about the particular place from where you're going to take these families. So you have to get yourself familiarized with the usual customs that are prevalent in that particular area, and these questions can be asked to them. Yeah, next. So then the next domain is about the health system. How accessible and affordable are they? So you have to ask about the treatment seeking priority and availability and utilization of health services. Again, depending on who are present in the particular family. So if you're seeing, if there is an antenatal woman, if there is a postnatal woman, pertaining to delivery care services, pertaining to antenatal care services, pertaining to immunization services, what is your treatment, health service system preferences? So that can be asked. Geriatric care again. So geriatric care, NCD would be predominant. So regarding NCD, where do they prefer to take medicines? Whether they prefer to go to a private hospital or whether they do not want to do anything about the particular disease. So all these things can be asked. So again, depending on the group who is present in that particular family. And then we shall also make a mention about whether their family had been visited by a, I'm sorry, I'm not able to see the slides. And whether the family was ever visited by a healthcare provider. So now, home-based newborn care, home-based antenatal care, home-based postnatal care, and for, home-based screening for non-communicable diseases. So we have to also ask about whether they had been ever visited by a healthcare provider. And if they had been visited by a healthcare provider, what was the purpose of visit by the healthcare provider? That has to be mentioned. And can I have the slide? So I would try to respond to question from Jaya Kavya, who has asked what geriatric. So if they have any particular illness, what do they think about the outlook of the disease? Whether they believe it is because of, whether they have a scientific rationale for them having the disease, or they believe in any superstitious beliefs, or are they okay with accepting that they are having the disease, or they are not denying the diagnosis? And so what is that particular thing that you have to, regarding that particular disease, what is their outlook towards the disease, and what is their outlook towards the treatment? That has to be mentioned when you are asking about geriatrics regarding the knowledge, attitude, and practice. So then you have to ask about, I mean, if there is any chronic ailment, or even for maternal care, how much expenditure they are making, direct expenditure and indirect expenditure in terms of transport, for loss of wages, and whether because of these health expenditure they have pushed to debt, or whether they are pushed to any catastrophic expenditure. That has to be mentioned when you're mentioning about the health system access. Next. So basically, we're trying to find out their outlook towards the cause of the disease, their outlook towards prevention and cure of disease, and we are trying to understand how they are connected with the health system, and how they are connected with the services provided, and how the choices are made, what makes them to decide on what services to be used. Next. So after you do this, all these things are about the family. You are asking, I mean, until now, all these questions are relevant to all family members. It is not specific to one particular person. All these things has to be mentioned about the entire family, pertaining to each and every family member. As a whole, as a family, what is the inference, what is the information that is collected has to be mentioned in all the other domains that we have mentioned. So when we are talking about illness, you have to talk specifically about the indifferent vulnerable group that are present. So if you have a neonate, you have to do his complete history taking pertaining to that particular neonate, and do a general examination and systemic examination, and finally you have to come with a clinical diagnosis for that particular person. So usually in family study, the index case would be mentioned. If you have more than one vulnerable group present in the family, a particular index case would be mentioned for whom you have to do a interview. So you have to do a thorough clinical, thorough history taking, thorough clinical examination and general examination. One thing that happens here is a lot of redundancy. You would be repeating the same information that was collected in the family study. You would be saying it, repeating it again in the while you're presenting the index case. No need to repeat information that are already mentioned. So say, for example, regarding the family, regarding the socioeconomic status, all these stuff, you had already mentioned. So stick yourself to only those information which are relevant to this particular person, to this particular index case. Should dietary assessment done separately for index case? Yes. So individually, for whether this particular person, this particular index case is consuming enough nutritious diet, yes, that we have to mention. Could you please explain an easier way of diet calculation? I mean, for example, I would try to do towards the end. So most of the time, all the family members are not available during the study. How do we proceed then, ma'am? So it depends on the person who is giving you the interview, who is the respondent. So we have to take all the responses which are given by the women. So as of now, until now, except for the index case, whatever the family member says, it should hold true, right? Ideally, how many visits to be paid for taking such a long history? Actually, it would at least take 2 to 3 hours, but we should get familiarized ourselves with the family. That is why we are asked to take, for the exams, we are given families from our field practice area. The major assumption there is we have visited that place quite often, and we know the macro environment. We would have visited these families at least once or twice earlier. So that is the major assumption that runs here. Yeah. So for this index case, please be specific pertaining to that particular index case. So when you're asked to present about infant, you have to ask history related to the birth history, the immediate neonatal history, and the breastfeeding history, the immunization history. All these things, particularly for this particular child, has to be mentioned. So avoid redundancy when you are presenting the index case. Next. So after you get all these domains, this is what we are trying to. So in PNC case, mother and newborn in family, who should be prioritized? Both should be equally prioritized. You should mention both about the postnatal mother and newborn. I mean, there is no, a different weightage given for mother or the newborn. Both should be equally prioritized. Both are considered as a single unit. So this is the, when you are doing a complete diagnosis, please mention all the domains that I have mentioned with regards to structure, with regards to family, with regards to socioeconomic, with regards to, cultural and social environment, with regards to environment, nutrition. Please find out all the domains. For each of these domains, what are the problems? So that would be your diagnosis. So in family study, we are not just bothered about the clinical diagnosis. We are bothered about all these aspects. We want to have a comprehensive diagnosis. So make a list of problems and all the headings that we have discussed, and also try to find out key threats. So, if you, after knowing about the knowledge, attitude, and practice, you may also find that this person could be non-compliant. The person is not willing to adhere to the treatment. So that could be considered as a threat. So find out what are the threats that are present in that particular family, which prevents this particular person from adhering to a treatment or adhering to a preventive action. So that has to be mentioned. So find out, list out the vulnerable individuals, identify the family, and then also make a mention on the medical diagnosis in a particular individual. Especially the index case which we are presenting. Next. So ideally, we would like to have such kind of web of interaction. Actually, the idea of any family study is you identify a problem, you identify problems in each of these domains, and then you are trying to find out how each of these domains are interacting with each other and how each of these domains are making a reason for causing the disease, and how each of these factors would be playing a role in determining the consequences of this disease. So if you have enough time, you can try to build such web of interaction. You can try to find out all these factors which we have discussed, put it in places, and how each factors are contributing to the disease, and how each of these factors can be contributing to the consequence of the disease. So try to build that. That is actually that should be the actual outcome of your family study. And then how are we going to write the management? Next. So you have identified, these are the different domains, and you have identified a problem. So for each of the problem, you have to propose a comprehensive management. I've just given a few examples. If you're seeing an elderly widow in structure domain, if you find out elderly widow is the problem that has been identified, the solution would be linking with the social security scheme if the person is not availed, or trying to build a social support system with the neighborhood so that she doesn't feel alone. Then about the socio-economic, if you think the family is a BPL family but with no insurance scheme, your proposed solution should be linking with the system for getting insurance card. So for each of these domains, identify the problem and propose a solution. So the solution doesn't always mean it should come from the health sector. It could be linking with the other sector. That could be one solution. And there are certain problems for which nothing can be done. If you have identified overcrowding as a problem, nothing much can be done. If you say there is inadequate ventilation, as someone mentioned, there is no exhaust ventilation in the kitchen, there is no window, no cross ventilation, probably you can propose them to have an exhaust ventilation. If the household is using, is not using LPG as a fuel for cooking, and if they are dependent on wood as a source for cooking, then you can propose them to use LPG. It is not just proposing them to use LPG, but also linking them with a scheme which would provide them at a subsidized cost. So that should be the proposed solution. So for each of the domains, identify the problems and propose a solution. Yeah, poverty is a big factor. We cannot do anything regarding poverty, but there are many schemes which are available which gives things at a subsidized cost. We can try to link them with those particular schemes. So this is how I mean, this should be the final outcome or the final uh, uh, management solution for a family study. It should be a comprehensive management of a family. It is not just treating a particular person and just ignoring all the other social factors in which the particular person is coming. So identify different problems. Please work on brainstorm amongst yourselves on different problems in each of these particular domains. What could be the proposed solution for each of the identified problems? What are the schemes that are available? What are the various social security schemes that are available, etc. can be thought of, and you can try to link problem with the solution. And someone asked about how do you calculate diet. Basically, try to find out what should be the, so for a family, if you want to calculate diet, if you want to calculate the nutritive value for an individual, I would request you to remember just 4 numbers. The numbers are: adult man, the calorie intake is 30 adult women, sedentary lifestyle, the calorie intake would be 30 kilocalories per kg per day body weight. Adult man, sedentary, the required calories is 32 kilocalories per kg body weight. Moderate worker, adult man, 39 kilocalories per kg body weight. Women is 37 kilocalories per kg body weight. So when you are talking about kilograms, the weight, it should be the ideal weight. So usually, how do we calculate the ideal weight? It is the based on Broca's index. The height minus 100 would give you the ideal body weight. And of course, if the person is a diabetic, you have to make correction for that. If the person is above 40 years, for each decade, you have to make corrections. So calculate the energy requirement for this particular person. Again, for protein requirement, it is 0.83 grams per kg body weight. So you can calculate the energy requirement. And regarding the consumption, I mean, you'd be easily calculating the energy requirement and the protein requirement, but how much it is being consumed? Please find out what are the common food items that are consumed by a particular by the families in the field practice area. It would be like most often the common food would be rice, sambar, idli, chutney, etc. So find out for 100 grams of each of these food items, what is the calorie value and protein value. I mean, we have no other way, but at least for 10 different food items, we have to understand, we have to know the calorie value, energy value, and the protein value, and we have to make a comparison. When it comes to family, I would recommend a stock inventory method. In the past 7 weeks, how much of various cereals were consumed, what grams of various pulses were consumed, how much vegetable items. So you can just use a stock inventory method instead of 24-hour recall method. So that helps you to find out how much in each food items, whether the family is consuming adequately or not. We can try stock inventory method, which is a better way when it comes to understanding the nutrition intake of the family as such. For an individual diet, 24-hour recall method would be the appropriate method. Yeah. Any questions? I think that yes, someone has raised hand.
Can I talk, ma'am?
Yes, please.
Yeah. Ma'am, suppose if in a family a person is having diabetes and the other person is having hypertension, then how do we take the index case and how can we define in our exams like why we have chosen this as an index case?
Actually, if the index case has not been mentioned by the examiner, you have to mention about both. You have to you have to consider each of them as a vulnerable population, and both should be presented.
Okay.
Usually in exams, the index case is identified. I mean, because there is a time constraint, right? You are not given enough time. You have to finish the entire study in an hour.
Okay. Ma'am, one more thing, ma'am. In the dietary 24-hour dietary recall method, usually when we attended the NIN postings, what they said is they have taken the raw food, ma'am. Raw food payment they have taken, and if at all the person has consumed outside food, then he will be given as a half consumption unit.
Okay.
He will not be given as one consumption unit. So in exams, like the 24-hour dietary recall method is we are not doing it properly actually. Based on based on those findings only we are recommending to the family members like your deficit. Every time we go to a family, like every time, maximum of the times, even though the person is overweight or obese, then what happens is always it will be a dietary deficit only will be coming now whenever we do the 24-hour dietary. So why not we go and do only the stock and inventory recall method for individual case also, ma'am, because one is not being done, and even we are taking as per guidelines it must be taken as a raw food, and here we are advised to take about the cooked food. What is the cooked food and to which level it is there, and we are not having the standard cups also, ma'am, because that's the main issue we everyone face in the nutrition. So what are your suggestions, ma'am?
Okay. Regarding diet, when you want to, I mean, my suggestion, it is completely my opinion. So for calculating diet intake for a family as such, I would recommend stock inventory method. But because that is going to be easier, you cannot be asking about, instead of asking them to recall on 24 hours, you can ask in the past 1 week how much cereals were consumed, how much pulses were consumed. That would be easier for them to understand because they have a stock of it, right? In the last 1 week, how much rice they have bought, how much they have consumed. It is easier for them to give us a reply. I would personally suggest stock inventory method, at least for understanding the diet intake of the entire family. But for an individual, it is usually you can, for an individual, you can go in for a 24-hour recall method. And also suggest that the necessary cups, to show the patients on different cup size, as a toolkit for yourself, you should carry those different cup size ladles, etc. That has to be in your toolkit when you're going for a family study. Apart from taking a weighing machine, etc., this also should be part of your toolkit.
Okay, ma'am. One more thing, ma'am. In the final diagnosis or the comprehensive diagnosis, is there any clear-cut things like first we need to talk about clinical findings, then the social findings, then the environmental findings, or what is
No.
it, ma'am?
So, you can construct your own pattern. There are no hard and fast rule on this has to be mentioned first. No. Identify the various problems, list out the various problems. You can, if you think the medical problem is the most important problem, you can start with that, say the solution for that, and then go to the other problems.
Okay. Okay. Thank you.
That was
Thank
an
you, ma'am,
excellent speech.
for the wonderful session, ma'am.
I'm sorry. There are certain questions which I missed. Row is the present. Okay. How much distance should regarding the energy from all food groups per day should be equal to RDA doesn't match when we calculate. Please give some example. Okay. Probably for the question that Akar has asked, I would I would try to demonstrate using an example and post it to the organizers. Organizers can send it across. How much distance should the cattle breeding place should be from the residence? I'm not sure on what is the recommended distance. Again, I would also try to refer and give you role of leadership in public health. I don't know why this is coming here. In calculating per capita family income in that family, 1 newborn, 1 5-year, and then newborn should also be considered while calculating the per capita income. Can you please suggest some specific health education advice for common index case like hypertension, diabetes, antenatal care? So regarding hypertension and diabetes, we should be talking to all the people regarding 4 important things. All these are called as self-management behaviors. One is regarding the diet. I mean, what should be eaten, what should not be taken. Second one should be regarding the physical activity. What do you mean by actual physical activity? How many days in a week they should get engaged in? And you should customize it according to the situation or the social factors, which allows the person to go in for physical activity. If the person is having access to a swimming pool or a well where he can swim, and if the person knows swimming, you can customize it accordingly. The third thing should be regarding the medications, complaints to medications, and why it is important to adhere to medications. The fourth thing is about stress management and how to cope up with stress. What are the alternatives that are available to cope up with stress? So these are the 4 constant message that we should give. And one more thing is about talking to them about complications, telling them which could be a complication and when to come back immediately. So this is the standard message that should be given for hypertension, diabetes. Regarding ANC again, you have this birth preparedness and complication readiness. If you are trying to address each of the components of birth preparedness and complication readiness, that would be the advice pertaining to ANC. And under 5, specifically regarding immunization, the child feeding practices and child rearing practices. So these are the specific things that should be covered. KAP information regarding antenatal TB, hypertension. Okay, there are many answers coming regarding the cattle shed. I would refer and tell you. Yeah, thank you. Over to the organizers.
That was an excellent speech, ma'am. And participants, there's a feedback form in the chat box. Kindly fill the feedback form. So we are grateful for the time and effort you took to share your view on family study, ma'am, by stressing on the importance of family study. And you have clearly explained each and every domain in family study. Your knowledge is invaluable, ma'am. Thank you. Thank you so much. And thanks to office bearers and digital wing. Special thanks to Dr. Saranya ma'am, coordinator of academics and research TADCOM, Dr. Kribakaran sir, joint secretary, Dr. Anantishwar sir, digital wing coordinator, Dr. Angelin, joint coordinator of editorial committee, and Dr. Amina ma'am for the member of our digital committee. And I also thank all the participants. We could see participants across the nation. We appreciate your involvement and hope you found the event a valuable learning experience. We thank all the participants for your active participation. We expect the same response for our upcoming webinar session. Thank you all.
Thank you once again for the organizers and the office bearers for the opportunity given. As I promised, I would try to give the answer for Dr. Thakkar, who has asked a question, and also the cattle shed. Thank you.
Thank you, ma'am.
Thank you, ma'am. And some participants were asking about the PowerPoint and the video. We will try our best to upload soon in our YouTube channel. You can check in